Are you ready to take control of your own health? Do you want to create a plan that will improve your health and vitality without the use of synthetic drugs or needless surgery? Hi, this is Dr. Tom Roselle. I would like to invite you to join me and the Roselle Center for Healing for an information, fun-filled day that will change the state of your health and quality of life. Ageless Health 2011 will provide you with the resources to begin your journey towards being stronger, having greater physical performance, and living longer without impairment, pain, or disease. Ageless Health is about realizing that your health is a do-it-yourself program. You can have it all. Ageless Health 2011 is your first step towards creating and enhancing your natural health plan. Register today to reserve your seat.
Ageless Health 2011 is September 17th at the Fairview Park Marriott. Learn more at rosellecare.com. Register before June 20th and receive 15% off seating. Call 703-698-7117. 703-698-7117.
Dr. Tom Roselle live right now, 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live in studio, 888-630-9625, 888-630-WMAL. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied, you've come up with the same old, not a whole lot that works very efficiently or well or permanently. Well, this is an opportunity for you to take the veil off the subject and find something that might actually reverse the situation without drugs and without the potentiality of surgery down the line. 888-630-9625, and hopefully you have the opportunity of getting out and going for a walk in this gorgeous day. We've had a couple of them back-to-back today. The rains are over, and they're threatening again coming up this week, so take advantage of today. Get outside and enjoy yourself and breathe and just, have fun. Because I'm going to when I get done with the program. I'm going out there, and yesterday I went flying, which was really nice. It was a gorgeous day, and went out to the Blue Ridge a little bit and checked things out, and it was just one of those perfect days to get out in a small plane. So I have to come up with something different today, but I will, and you should too. 888-630-9625. I'm going to have a interesting discussion with you today, something that we all need to talk about, because we all run in fear of this deadly situation. And that situation is what? Leading causes of death in the United States. Yeah, our demise, when we check out early, when we're supposed to be living 120 to 130 years or so. And we know that the leading cause of death is highly preventable. And what is it? Heart disease. The number one cause of death in this country is heart disease. The second cause of death in this country is malignant cancerous tumors. So the first one is 25.4% of all of you that are going to check out. That's the way you're going to die, 1 out of 4 of you. And the next one is cancer, 23%, almost much. The next one is cerebral vascular disease. That's when your brain gets all messed up and you have a stroke, right? And that's 5.6% of us. And then it goes down from there, and we talk about things like respiratory disease and accidents and Alzheimer's and diabetes in that order. And some of you will get the flu and you'll die of that, and that's only 2% of you when you get older. And kidney syndromes, and then blood infections, and then you go into suicide, which is number 11, then chronic liver disease and Parkinson's disease, which is number 14, and then all others from that point on is about 18.6%. So there's a whole bunch of other things that tail onto that. But what we're going to talk about is the most common causes of death. Remember what I said, and I've reiterated many times, is that you can decrease your risk, and I want you to remember this as we go through. You can decrease your risk of dying from any disease process, no matter what it is, by 50%. 1/2, by doing something very simple. That every day you start your day with a walk, or find a period of time that you do it every day at the same time. Walk 2 miles every day. Now, noticing, I'm not saying how fast you should walk. I'm not saying when you should walk. I'm just saying get out and walk and build yourself up to where you're walking 2 miles a day. Obviously, if you get a little faster clip to it, it'll be a little bit more beneficial, but nevertheless, not running, not a treadmill, not elliptical. Just walk. Get outside and walk. Bundle up, put a headset on, whatever you want to do, get out and walk. And now you've decreased your risk of participating in these statistics by 1/2. Seems kind of a easy thing to do, right? Well, we're going to get into that a little bit more. And what you need to know is that there's a lot of predispositions that are there, and you can change your arteries clogging up, and you can change your risk factors dramatically by doing some simple things. But first you have to understand how the body works. And see, when we're talking about cardiovascular disease and heart disease, we're also talking about things like diabetes and other inflammatory pathways, because the heart breaks down for a lot of different stressors. 1, neurological stressors, 2, biochemical stressors, and 3, emotional stressors. Kind of covers the bases, doesn't it, for pretty much everything. So let's dissect this. Let's kind of look at it, because there's so much that you can do and to not do it, and just to be at effect of all the advertising that's out there that you have to take certain things. And, you know, the statistics that you're being fed are actually very, very wrong, and there's a lot of stuff in the medical literature that would tell you that there's different ways. But what I want you to understand is the heart and the cardiovascular system have a lot of things in common. And what do they have in common? Well, obviously, the heart has to have a blood supply, and the vascular system brings the blood supply to it, and there's things that affect that. Did you know that the number one thing that causes the heart to work and the blood vessels to work is the nervous system? The nervous system, the brain, spinal cord, the nerves that come off, the peripheral nerves, and they go to and they attach to these systems. So the heart particularly has 3 primary sources, 3 electrical sources, if you will, that allow it to run the way it's supposed to run. One is the pacemaker within the heart. Now that gives you supposedly the contraction of the heart and gives it the rhythm and so forth and so on. But you've got 2 other sources. You have nerves that come from the spine that go directly to the heart. You have nerves that come from the brain. It's called the cranial nerve. It's the vagus nerve that comes down and attaches itself to the heart. So we have 3 sources. And some physicians and researchers will say that the heart actually is an electrical field by itself, setting up a rhythm for its functional capacity. See, the heart cannot work and push all that blood through your system all by itself. There has to be some assist, because it's not big enough. It just doesn't work. It gets the job started. It puts oxygen into the blood, and it starts the rhythm going. But the arteries, things that go away from your heart and bring blood to the other areas, they have a muscular contraction to them, and they contract because they have a neurological impulse. So what we're going to do is we're going to take a look at this subject in a couple different ways today. I want to talk to you about how that nervous system sometimes is the primary cause of not allowing the heart to work at maximum efficiency. And then we're going to talk about the biochemistry a little bit. We're going to talk about statins. We get a chance, because statins are not how you fix heart disease, particularly when they cause all kinds of side effects, primarily cancer and loss of function and heart failure, and, you know, they kill you anyway. See, the statistics that I'm quoting you don't have those into consideration, and you really need to know that that's true as we move forward. But, you know, plaquing, the process of plaquing, how it affects the system, the prevalence, you know, of this in society, what happens. But there's this huge, huge elephant sitting in the room, and nobody wants to talk about it, and it's called, you know, the Great American Lifestyle. And the lifestyle that we start out with diet and stress patterns and nervous systems that aren't working and the like. So let's start with really what takes place. And I'm going to talk about the structural point of view. You know, as a practicing chiropractor, acupuncturist, nutritionist for the last 35 years, I've had the opportunity to see people walk in with all kinds of problems, from metabolic pathway problems to pain and so forth. And, you know, they'll report with back pain, they'll report with numbness in their hands, and sometimes it's straight pinched nerves, and sometimes it's an organ system that's referring to these areas. So, but because we're talking about the heart, we need to look at that and that perspective. Well, if the nerves that we talked about earlier, the nerves that come from the middle of the back, upper back, where your rib cage is, the nerves that come from the brain, the vagus nerve, and the pacemakers are not working at capacity because they have irritation, overstretch, compression, some form of mechanical disturbance to them, then guess what? The target that they go to now becomes dysfunctional. It works less effectively over time. The nerves that come particularly from the upper part of the back, the first, second, third vertebrae. It's called the thoracic spine, or also the dorsal spine. Those nerves come out. Those are primary to the heart and the lungs. And many of us, over time, because of posture patterns, end up with chest pain. We end up with cardiac-like symptoms. And we see this all the time. Another piece, as we're talking about the heart, and we're going to kind of put all these together, there's a muscle that cuts you in half. It's called the diaphragm. Diaphragm's a huge muscle, right? It separates the lower portion of the body from the upper part of the body and acts as a big pump. It's one of the mechanisms that help move the heart. Well, this muscle, like any other muscle, if it's not working the way it's supposed to, if it's not facilitating action the way it's supposed to, then that heart and the lungs are also going to not work properly. So we have to look at the nervous system. We have to look at pinched nerves. The patient comes in, says, my doctor has diagnosed me with angina, which means chest pain, heart pain, and he's put me on all these things, and my heart's misfiring, and I'm getting these irregular heartbeats, and so forth. And often, what it is, it's a diaphragm, this muscle that cuts you in half in the middle of your body, not firing the way it's supposed to. It's not giving as you breathe, so it's put pressure. It's supposed to let go. It's supposed to go downwards as you breathe in and upwards as you breathe out, so it helps pump. And then there's the nerves from the neck and from the middle back. See, there's a nerve called the phrenic nerve, and that comes from the second and third nerves that come from your neck and goes all the way down and touches that muscle, that diaphragm. It's called the great mimic because it mimics heart problems. See, over time, though, because it's not working the way it's supposed to, then the heart deregulates itself, and we begin to see abnormal function. Abnormal function begins to perpetuate itself, and so forth. How many of you see people who are kind of rounded shoulders and their middle back just doesn't seem to want to move the way it's supposed to? Well, when you see that, that also is an indicator that those nerves aren't firing the way they're supposed to, that there's an overstretch or compression. And remember, I said those nerves go a lot of places, but one of the places does go is to the heart. So you have to be aware that structural function can be the preliminary cause of all kinds of organic dysfunction. And then you add that to the Great American Diet, which we began to talk about a little bit. The core issues being, your refined carbohydrates and sugar-laden, all kinds of things. And this begins to cause inflammatory reactions, which we've talked about over and over again, meaning insulin-resistant conditions. And if you're insulin-resistant, you're also resistant to a lot of other hormones. The Journal of the American Medical Association talked about metabolic syndrome and put out some very interesting information. And they said that metabolic syndrome is defined in patients that have at least 3 of the following risk parameters. 1, if you got a waist measurement over 40 inches or greater in men and 35 inches or greater in women, your triglycerides, your heavy fats, are increased over 150. Your good cholesterols are less than 40 in men and less than 50 in women. And your blood pressure is about 135 over 85, or is greater than that, and your fasting blood sugar is 110 or higher. Now, the prevalence of metabolic syndrome, the reason that we're talking about this, is because it causes your risk level for heart disease to dramatically increase. And, we said 25% of all adult Americans, that's about 48 million people here, and 34 to 35% of Latin Americans have this problem. It causes dramatic deterioration in health. Now, we could add that to cancer. We can add that to diabetes. Because they're all kind of the same core issue. But first, let's not forget, we have neurology, and then we have chemistry, and we're going to take the lid off of that today for you. We're going to talk about why this is so important. We're going to talk a little bit about the omega-3s, why they work, and by the way, they're anti-inflammatories, but in some situations they're also pro-inflammatory. We're going to talk about the statins and the risk to cancer, because you go in and your doctor says, oh my God, your cholesterol is at 200, we want it way low, which is the wrong idea, because the lower it gets, the worse it gets for you. You don't produce the hormones, and hormones, testosterone particularly, is so important for all of us. You too, ladies.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm here at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. We're talking a little bit about heart disease today, and we're going to talk about statins and omega-3s and some other things if we have time permitting. But first, let's go to the phones. Is it Anna or Ina?
Ina.
Ina, thank you for calling. How can I help you?
Dr. Roselle, I've had this little bump under my tongue. It's a blister type, very small, and it's very elusive. It comes on, it's usually in the evening, and it lasts until maybe about 12 o'clock or so, and then it ruptures, and I get a taste like blood in my mouth for a very short time, and then it's gone.
How long have you had it?
I've had it for like 2 months.
Okay. Did anything change in your diet or your life, within 30 days before this started appearing?
Well, I've had quite a bit of stress.
Okay, that'll do it all by itself. There are many causes, and without seeing it specifically, I'll give you some ideas. But, I mean, if it was a bump that was hard, then it can be a stone that's called a cyalolith, but it also can be a herpetic type of ulcer, and it comes about and it'll rupture. It can be a mold or a fungus. It can be things that you're allergic to, you're sensitive to, but it also can, can be, there's something called, there's an old word called cha-cha bump, but it's basically a combination of a fever blister, again, which is a herpes ulcer. The diagnostic piece of it is where it is. If it's filled with anything, you say that there's a little blood with it.
No, it's not. There's no blood. There's just a taste in my mouth I can feel it. My tongue keeps going there and checking it all the time.
Okay, how about after it ruptures at the end of the day?
When it ruptures, there's no blood. I squeezed it once with a Q-tip, and then I had a little blood, and I put some glyoxide on it.
Did that help it?
No. Well, it was gone then, and it didn't. I didn't see it anymore.
Okay, my guess is that it is a stress-reactive problem, and it's coming from your intestinal tract. And what I want you to try, something that will not hurt you, go to Whole Foods and go get yourself a pretty potent, ask them for a good organic source, but a strong source of a probiotic, the good bacteria that goes into your intestinal tract.
Yeah.
And I want, whatever the dosage is on the bottle, I want you to take twice the dosage 3 times a day and see if that works. And I suspect that it's going to make a difference. But what it's telling me is that your intestinal system is being upset by some other things. Try that first. Give it about 5 days to a week. And then you have a computer?
I do, but I'm very bad at it.
Okay, I was going to say, get a hold of me on the computer, and you can write back and forth for me. Just send me a note at rosellecare.com, or wait a couple of weeks and then give me a call on the air and let me know how it worked out, and then I can give you some other direction. But I suspect if you just do that, it may make a huge difference. It doesn't sound like an infection. It doesn't sound like a cancerous lesion. Again, I'm hedging my bets here because I can't look at it, but how you're describing it kind of sounds like that. So give that a try, and let me know within a couple of weeks how it is. Ina, thank you very much for your call. I appreciate it.
Probiotic?
Probiotic. That's all it is. It's the good bacteria. That's all you have to remember. Go to Whole Foods, ask them that you want a strong source of a probiotic or good bacteria that goes in your intestinal tract.
Strong, and twice the dosage.
Yes. Okay. Thank you, Ian. I appreciate your phone call. 888-630-9625. That's 888-630-WMAL. I'd like to remind you and encourage you, coming up in September, Ageless Health, our keynote event. Ageless Health 2011 is a day that will transform your wellness, your health, if you apply it for the rest of your life. Wouldn't it be nice to be able to take charge, take control of your own vitality, your own health, and not leave it to anybody, to be able to turn these things around, even cardiovascular disease, the things that we're talking about today? Well, it's totally possible. You can have all of that. If you could have the vitality at any age, if you could have the strength that you wanted at any age, it's really a matter of understanding how your body works. And this is what we do. on September the 17th. It's an all-day event. We start out with core training exercise in the morning. Then we go into topics. There are going to be guys that are there that are vendors that are going to show you what's new in the integrative care community. We're going to get back into session. There's going to be a demonstration of Tai Chi that you'll find extremely fascinating. We go back into session. And those of you who register will be entered in a drawing for $1,000 worth of wellness care. I mean, that's unbelievable value, plus the other things that are going to be there. Trust me, for the price that you're going to pay, plus your lunch, you get an organic lunch for all of that as well. It is a day worth paying attention to. Go online at rosellecare.com or call our office at 703-698-7117 to register. Remember, if you register before the 20th of June, you get 15% off. So don't hesitate. Make sure you do it.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio on this beautiful Washington day. Give me a call, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. We're talking about heart disease and some of the things that are associated with it. We talked about the heart has 3 different electrical sources. Pacemaker, it has the vagus nerve from the brain, and has what we call the splanchnic nerves that come off the spine, and these guys regulate the heart together. And when you don't take that in consideration in treating the capacity of the heart and the blood supply, the vascular system, we've missed one huge piece of the puzzle. If those nerves are overstretched, if they're compressed, you got a problem. You need to make sure that that's working, and that diaphragm, that muscle that separates the lower and the upper portion of the body, that allows for a second pumping action of the heart and the lungs, is also working properly. Chiropractors, by the way, do that better than anybody else on the planet, and you need to consult a chiropractic physician about that aspect of it. And then when you have practice like ours that does nutrition and acupuncture and all the other pieces, well, you got it all in one place. But nevertheless, 888-630-9625 is how you asked me a question today about what we're talking about in cardiovascular problems. You know, I get crazy every once in a while because I read stuff that I share with you and that nobody wants to talk about, or later on they come through the back door and deny that it was ever out there. And there was an interesting article that goes back a while ago, and it was written by a guy by the name of Brian Peskin, and it was called Statins and Cancer, The Hidden Story. And it's very, very interesting. It's several pages. But what I want to tell you is that this whole thing about statins, you know, these anti-cholesterol drugs and so forth, well, this is big pharma working at its very, very, very best. It's getting you to think that, you know, your cholesterol level has to be at a certain level, and if it's not at that level, we've got to drop it. Well, first of all, the research was done by big pharma. It wasn't done by any, university someplace out of their own nickel in their own pocket, but it was funded and done by the drug companies. So you roll the clock back about 10 years ago or so, and straight from the Journal of the American Medical Association, they came up with something very interesting. They said, and I'm going to quote because I have the article in front of me, it says, "Our findings do not support the hypothesis that hypercholesterolemia, meaning high cholesterol, and high LDL cholesterol, that's the bad cholesterols, or low HDL, or low, that's the good stuff, and that also known as the good," they said, "are important risk factors for all-cause mortality, death, heart disease, and mortality due to or for hospitalization for heart attack or unstable angina, chest pain, and in this cohort of persons older than 70 years old." So here's the deal. What this really means is that it ain't all what they're saying it is. And death causes come about for a lot of different reasons. And it's just not about cholesterol. And it goes on to say that LDL cholesterol, the bad cholesterol, is bad science. And this was published in the Journal of the American Physicians and Surgeons. Now, when they're saying these things in their own journals, doesn't it make you stop to think why the hype, what they're doing out there? The concept, another quote, that LDL, bad cholesterol, is a simplistic and scientifically untenable hypothesis. And this was going to press, in the Journal of the American College of Cardiology. I don't know about you, but my brain starts saying, okay, then there's got to be something else that's taking place here, and where do we find all this stuff? Interesting article in Lancet, and this goes back even further. And says, it goes on and says, for decades, saturated fat was blamed for buildup of arterial plaquing, and it's a very simplistic view. However, in this article in Lancet, the medical journal, very respected journal, going back over 15 years ago, 16, 17 years ago, in 1994, it shattered the myth completely. So the investigators analyzed plaque and found it to contain more than 10 different compounds, none of which consisted of saturated fat. There are also other independent analyses confirming that the lack of saturated fat in any type of arterial plaquing. So then you go, well, what's that all about? What's going on here? It's you being hoodwinked, my friends. And if you're, been a patient of ours and so forth, well, there's a lot of reasons that you need to know about, and we could spend 2 shows talking about that, and we will continue, and I'll blog about it. By the way, if you want to be privileged to a lot of things I put on the internet, you can go one of 2 ways. If you have a Facebook account, you go into facebook.com and then go to Roselle Center for Healing. We have a business site, and I'm putting things there every week. Or you can go into RoselleCare.com, and you'll find our webpage with everything that we're doing, and you can go directly that way. But it's important. I try to keep you up to date. Susan, how can I help you? And thank you for calling. Susan.
I have a friend who has diabetes, and he gets sores on his ankles, and they're kind of dark brown, and then they get very painful, but sometimes it sloughs off, and then it's raw underneath. I was wondering, and he limps from it, and it comes and goes, maybe every 1 or 2 years.
How old is he?
Oh, he's about 66.
Okay. The first knee-jerk, without seeing it and without having some other information, it sounds like a cardiovascular problem where he's not getting enough circulation to the lower extremity. And that, coupled with fatty acid metabolism, could be causing this. It's a very typical ulceration type of condition. So the first thing that you look at, from my perspective, you don't want to just fix something by giving even a nutritional product, even though there's things like niacin, niacinamide, B6, ginkgo. All these things open up the small vessels in circulation, and they will help. They'll make a difference. You also have to put in essential fatty acids, the omega-3s, and that also will make a difference. Vitamin D also is one of the things that will cause that type of thing. Deficiencies in that level can cause all kinds of skin changes. Now, having said that, we need to find out other pieces of the puzzle, but he also has to be willing to make some lifestyle changes, and if he does that, the body is an extremely forgiving mechanism, but it's individualistic. What we're looking at is an inflammatory pathway problem here that's causing a lack of circulation, a decrease of fatty acid metabolism in the body, and subsequently a degradation of the skin tissue. If it adds to swelling around the ankles as well, then we've got a heart problem where the heart isn't working. That's usually as a result of coenzyme Q10 being depleted. Is he on medications as well?
He's on, I think, a diabetic medication.
Yeah, that's an inflammatory pathway. My guess is that he's also probably has some heart issues, or they've got him on some either blood pressure medications, or they've got him on a statin, and all of those things are going to add to that. But, Susan, it can be turned around. Encourage him to write me at RoselleCare.com, and maybe I can put him in a direction that would be useful. Thanks, Susan. I appreciate your call. Marie, how can I help you?
Oh, good afternoon. I was wondering if a person has 6-millimeter gallstones through a sonogram, how does one tell the difference between gallbladder disease and heart disease if a person has heart problems, and what does one do about it if it is gallbladder disease and they are 6 millimeters, I guess it is large. Should they take it out, or is there another course?
No, there's another course of doing it. It depends on whether they're obstructive or not. If the stones are in the common bile duct and it's obstructing and the jaundice level is starting to show itself on the skin surface or in the eyes, or if on blood work we're starting to see a change in liver function or the other indicators that would suggest that we have more of a problem, then you have an immediate crisis situation, and that's one of the things that I will tell you, that when you're in crisis and it has to be done yesterday, it has to be done yesterday, and that's where you find the best of the best to get it done. Now, setting that aside, dietary changes and decreasing inflammatory response within the body is critical. There are things that will continue to cause gallbladder problems, and there are things that will continue to cause heart problems. Often they're one and the same. So you have to change that, but you want to change the body so it's in a very alkaline environment, so these things begin to dissolve. You have to get rid of, my mantra, sugars, sodas, coffee, teas, or black teas, fast foods, fried foods, alcohol, gluten, additives, preservatives, and so forth. Get those things out first. Add tons of fresh vegetables in the diet. Stick to white fish and organic chicken. Begin to add fatty acids to the diet, and then things that will help begin to soften and dissolve. There's some homeopathics that will do it. Anything that has phosphorus in a homeopathic form can be useful. Choline, lecithin, and acetol. Those are all things that are used. Now, I'm not going to prescribe for him because I don't know him, but the beginning stages of diet will help. Exercise, walking will begin to flush the system out. Tons of fresh alkaline water, at least minimum of 2 to 2.5 liters of water a day, and put a little bit of lemon in it, and that also will begin to help dissolve that. But there are gallbladder flushes that will work, that we deal with our patients all the time, but you also have to look at that electrical system. The gallbladder often becomes sluggish for no other reason except that the nerves that go to it aren't working the way they're supposed to work. So it can be done. You can have them write me at rosellecare.com. I'll be more than happy to go back and forth with them.
Can I ask just one short question?
Yes, ma'am.
Is there such a thing as chronic appendix, which is not acute, a chronic, which would come and go during the years?
Sure. There's a syndrome called ileocecal valve syndrome. What its name comes from is the terminal and the end point of the small intestine called the ileum, the beginning point of the large intestine called the cecum. And then when they come together, it's a valve, not really like a valve you turn off and on, but they're three muscular rings that allow food, once digested from the small intestine, to be kind of milked into the large intestine for elimination. Now, the appendix sits right there at the beginning portion of the cecum. And if you're getting not complete elimination, if that valve isn't as competent, it's not an open valve, it's just an incompetent area because the nerves from the low back are being irritated, or the dietary pattern isn't good, where we're getting a lot of hot, spicy, or crunchy foods, or even soft foods that are just kind of stuck there or irritating it, or we're allergic to something, particularly gluten. If somebody is allergic to gluten, it can raise all kinds of havoc with that area. Those things will make life worse. So yes, you can turn that around. Chlorophyll, comfrey, food grade aloe will also help decrease the inflammatory response. In times of when it's really painful, take a bag of ice and put it over the top of that appendix area. It'll calm it down. But you have to fix the neurology. You've got to fix the dietary pattern. You have to supplement properly. It can go away. I hope that's helpful, Maria. Thank you for your call. You're listening to Dr. Tom Roselle Live. I am live in studio at 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're talking about some very interesting things. We're kind of picking away here at the statin mystique, so to speak, if you will. And, manufacturers have known forever that cholesterol-lowering drugs were known to cause cancer, and it goes back more than 15 years ago or so, and there were trials of cholesterol-lowering drugs and to prevent cardiovascular disease, and they demonstrated a dramatic, not just once in a while, but increased risk of cancer. And they kind of set it aside. The trials were randomized. They were double-blind studies. So it's there, and yet they continue to ignore it, and they're ignoring it at your risk and at your detriment. So what I want you to know is that when you take things, because the good old white tower doctor tells you to take them, and he's being informed that they work by the drug companies, and the drug companies have a vested financial interest in you buying their stuff, think about it really, really hard before you say yes, and understand that there's a lot of other ways to fix things, and it's in your hands, and you can prevent the plaquing, and you can stop the nonsense, and you can keep your body going. The references are there, and I've got them, and it's just, there's hundreds and hundreds and hundreds of them.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're at 888-630-WMAL and answering all of your questions and giving you information, and hopefully I can make you think differently than what you did before you listened to the program today and every Sunday at 12 noon. Want to remind you that Thermography Centers of Fairfax is offering you a special this month, 20% off of any thermographic imaging scan. You've got to call them before the month is out, no matter if it's a full body scan or a breast exam or anything else. And we want you to know that what thermography does is it picks up heat signals, inflammatory pathway problems, when you have a chance to do something about it. It shows you the signs of what we call vascular neogenesis, which is the beginning stages of blood supply to abnormal tissue. And it can be cancer, and it shows it up 5 to 8 years beforehand, before it can be identified as any kind of tumor formation, when you actually have a chance to do something about it. I want you to call Dareth Painter at 703-943-7248. That's 703-943-7248. And schedule it this month and save 20%. Let's go to the phones. Lily, how can I help you?
Yes, Doctor. Good afternoon. I get a lot of sores, the herpes sores, the cold sores in my mouth. They go away, and then they stay dormant, and then they come back shortly after. I've been putting Abriva, but they don't seem to go away. They keep on coming back, and they're very painful.
How long have you been suffering with them?
Years, doctor.
Okay,
years.
So it tells me that your immune function is low. Probably what's called your serum IgA antibody levels are low. That has to do with the capacity of the adrenal system to stimulate your immune function. But I don't have a lot of time, and if you will write me at rosellecare.com, I'll answer your questions. But let me give you just a little bit of an understanding with it. Eliminate any kind of peanuts, peanut butter, peanut oil. Eliminate, if you eat eggplant, eliminate that. Increase lysine is an amino acid, Lysine. Take about 3,000 milligrams of L-lysine on a day-to-day basis. Add some probiotic, the good bacteria that's in your intestinal tract. Increase your vitamin C level, because that's antiviral as well. See if those things work, and then let me know or write me, and I'll be more than happy to point you in the right direction. Lily, thank you for your call. Brian, how can I help you, sir?
Yes, good afternoon. I have, my main concern for the cause, I was diagnosed with having colitis. I had a colonoscopy.
Mucus colitis, or are you bleeding?
No, I'm not bleeding.
Okay.
The colitis is just causing diarrhea and upset stomach. I guess it's inflammation of my intestines, according to my understanding from my doctor.
Question. We only have 30 seconds.
Okay.
Tell me, what's your question?
Okay, the question is, he gave me some medicine to take for the anti-inflammatory and antibiotics. They worked. But he took me off the antibiotics, and now the anti-inflammatories don't work at all.
Okay, so it tells me that you've got a bacterial infection within the intestinal tract, and it may be something that needs to be done by increasing your immune reaction, as well as getting rid of gluten, which is any kind of grain in your body. That's something that needs to be looked into very carefully. I'd be more than happy to, I'm sorry I don't have the time, but get a hold of me at rosellecare.com. Tell me that we talked on the radio, and I'll be more than happy to go through it with you step by step. It was a great question. I wish we had time to completely go through it. You're listening to Dr. Tom Roselle Live, and I'm here every Sunday at 12 noon, bringing you the best information possible to change your health without drugs or surgery. See you next week. Bye. Health is a do-it-yourself program. That's reality and the title of my new book. This is Dr. Tom Roselle. Health is a do-it-yourself program is a most understandable introduction to natural health care. My book will take you step by step through why the body breaks down and gets sick, but also how it repairs itself. You will finally understand the often confusing world of natural care. Order it today by going to Amazon.com or from our website, rosellecare.com. That's rosellecare.com. Hi, this is Dr. Tom Roselle. If you're looking for a wellness and healthcare environment to showcase your business, products, and services, consider being a wellness partner of Dr. Tom Roselle Live and the Roselle Center for Healing. From in-show advertising to on-site events and digital marketing, we have several offerings that can highlight your business with a well-received and established audience. For more information, visit WMAL.com, keyword Roselle, that's ROSELLE, and click on Become a Sponsor.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.